First, when I first started this, I really just wanted to help patients. You know, I couldn't believe that patients were being denied this drug, and I could sense that we were not going to be able to fix this from a government kind of policy position because the doctors themselves had drunk the Kool-Aid and not been willing to prescribe this drug. And I tried very hard to get the policy changed so that hydroxychloroquine could become over-the-counter in our country, just like it is in much of the world. That would have been the best solution for everybody because it would have taken the decision-making out of the hands of the government. You could have decided for yourself if you needed this medicine. And the advantage of having that pill in your possession meant that the majority of people would have stopped living in fear. So that was the best solution, but we were unsuccessful in getting that. So I did the next best thing, America's Frontline Doctors, not I, just a group of us, and we made getting hydroxychloroquine available for the entire nation by going to our website. Then you can consult with a telemedicine doctor, and whether you have COVID or you don't have COVID, or you're just worried about getting COVID, you can get yourself a prescription and they mail it to you. That was the first thing we did, and I felt so strongly about it just because that's a practical way that you can try to lift the fear. But I learned pretty early that the big fight was the fear. The big fight wasn't the virus, it was the fear. That was my response to the fear, was to give people a practical solution. Now, the fear has led to people, they really just want to go back to normal lives. So they're either kind of consumed with fear or consumed with just being weary of the whole situation. That is what I think is leading to people making what is really a fundamentally irrational decision to rush headlong towards an experimental medication. They just kind of want to get their lives back, right? We've been told, oh, get the vaccine, you'll get your life back. I have to give you the bad news. That is definitely not what's going to happen. Whether you take a shot or you don't take a shot, it's not going to happen. You know, Dr. Fauci has gone public already with saying, and as many others, the Surgeon General, many others have said, it was in Business Journal just today, Business Insider, I think just today, you know, this so-called vaccine, experimental biological agent, actually doesn't stop transmission. You're going to have to keep going with the masks and the social distancing. It actually changes nothing. Once you hear that, you really have to question why you would put yourself in that situation. So that's the starting point. Let's talk about some enduring COVID-19 myths. First of all, I'm glad that, you know, I can't be deplatformed here, but let's just talk basics about the numbers. Okay, what is the chance that you'll survive COVID if you should get it? Okay, so this is a very educated audience. So if you're under age 20, according to the CDC, which is not known for its honesty, the survival rate is 99.997%. Why are we talking about anything in that group? There's nothing to talk about. For ages 20 to 49, the survival rate is 99.98%. 50 to 69, their survival rate is 99.5%. I always kind of pause there because a lot of people in their 50s, they start to get worried and they think, oh my gosh, I'm in such a high-risk group. It's not really that true, right? This is with no treatment, your survival is 99.5%. And if you're over 70, the survival rate approaches 95%, really with no treatment. Now, the dirty little secret, it's even better than that, right? If you take early treatment, this is essentially either asymptomatic or very mildly symptomatic or completely recoverable. The people who die from COVID-19 are people who are kind of destined to die in this period anyway. Which is tragic, but as people of faith, you understand that life and death go hand in hand. So my father had an expression, it was that pneumonia is an old man's best friend. And that means that pneumonia is often the way we exit this world. So if you are at kind of the end point of your life, COVID-19 can take you out. That's a fact. So can a common cold. I've seen it. I once had a patient in the ICU who died essentially from a nosebleed. It kind of escalated. So anything can take you out if you're frail. And COVID-19 is in that category. Overwhelmingly, the deaths of COVID-19 are in nursing home patients. And I have to mention that because if there was truly the intent to quote unquote save lives, people would not have thrown away our frail elderly The politicians that are telling you to do this thing over here had no problem throwing away the lives of the very frail elderly over here. I don't know how many, if anybody in this room was watching the coronavirus task force meetings as closely as I was, but I was watching them every day.